Health authorities are due to announce a timeline for dropping the indoor mask mandate this Friday. That comes one day before the Lunar New Year holiday and exactly 3 years since the country's first case of COVID-19. Our Shin Se-byuk has more.
The South Korean government is set to decide the timeline for almost completely ending the indoor mask mandate this Friday as the 7th COVID-19 wave subsides. This is according to Interior Minister Lee Sang-min during the government's virus response meeting on Wednesday.
With this winter's COVID-19 wave past its peak, the overall virus situation is stabilizing.
The indoor mask mandate is the last remaining antivirus measure left in the country. Last month, the government announced a two-phase plan to scrap the indoor mask mandate. In the first phase, mask wearing would no longer be required, but rather recommended in public places except for high-risk facilities such as hospitals and public transportation. And this would only be possible if 2 out of 4 criteria were met. The criteria include a stable number of new infections, a downtrend in critically ill cases and death, sufficient medical response capabilities, and a boost in the vaccination rate among people aged 60 years old and above, as well as those working in or residing at high-risk facilities. As of now, 3 out of these 4 requirements have been met, with the exception of the booster take-up by older people. In the second phase, the mandate would be completely lifted for all places. While some speculated that indoor mask restrictions would be eased as soon as after the upcoming Lunar New Year holiday, it's now widely expected that the new policy will be implemented at the end of the month due to uncertainties such as the current situation in China. One expert, meanwhile, says the most important thing to consider now is the country's capability to handle a health crisis rather than when the mandate is dropped.
When to downgrade the indoor mask mandate to a recommendation isn't important. We should now think about whether the country's medical system is really ready for and capable enough to handle the situation if things go bad all of a sudden.
As for the prospect of future infections after the lifting of restrictions, medical experts believe figures would stay at around the current level. Shin Se-byuk, Arirang News.